Doctors are preparing for a surge in flu cases this week after recent CDC data shows nearly 5 million cases across the country already. New York State is seeing its worst flu outbreak in more than 2 decades. Medical correspondent Dr. Darien Sutton joins me for more on this. Dr. Sutton, always happy to get a chance to get advice from you. I know you see this firsthand. What's kind of behind this surge in flu? It seems like it's a lot worse than usual.
Yeah, the emergency room has been quite busy, Elizabeth. When you're looking at the numbers, specifically here in New York, you're correct. The numbers are the highest numbers of the flu that they've seen since we first started recording flu rates in 2004. Over 70,000 cases, and that number was dated December 20th. That's 38% higher than the week before. Important to note that climb is there, and 63% higher in terms of hospitalizations. Now, what's behind this? There's a new flu variant, subclad K or subclade K. It appeared during the summer, and it appeared after the flu vaccine was manufactured. Now, that's important to understand because that can reduce the effectiveness of the vaccine. But thankfully, early evidence have still shown that these vaccines are providing protection, reducing the risk of hospitalization and severe illness up to 40% for adults, and for the same for children up to 75%.
I mean, as you always say, it's not too late to get vaccinated, even if you haven't. For kids, what do we need to know about treating kids, and why? How is this affecting kind of younger people too?
You know, I'm talking about this with parents because half of the documented numbers here in New York, half of those reported cases are children. And so the majority of patients who are coming in with illness are children. Now, important to note, children are resilient, but the risk isn't zero. Last year, we saw the deadliest flu season for children that we've ever seen since 2004. Over 280 children lost their life. Important to note, nearly 40% of those children had no prior medical history. For many, that was their first visit to the hospital and being hospitalized. So that's so important to understand that the risk is there. Now, what parents need to know is that the best way we know how to reduce that risk is, of course, through vaccination. And secondly, reducing our risk of exposure. That's by masking, because the flu virus, as well as RSV, which is also circulating, is a respiratory illness. And then washing our hands, cleaning high-touch surfaces. This is the time when you have to be extremely cautious.
If you are feeling a little bit of symptoms coming on, what can you do to kind of avoid that and try to keep your family healthy too?
You know, if you are starting to feel symptoms, this is when you need to keep yourself as healthy as possible. That includes rest, that includes hydration. And if you are high risk, for example, if you're over the age of 65, if you are pregnant, if you're immune compromised, or if you're having severe symptoms that are rapidly progressing, talk to your provider about antivirals like Tamiflu. We typically give those for high-risk patients, but they are best used when started within 2 days of symptom onset, and that's when they're most effective.
And you can still be contagious
and
through that
you
time.
can still be contagious during that time. It's so important to note because I diagnose the flu often, and many times I watch patients walk out of that ER, I hand them a mask, and they put it in their pocket.
No,
so just
that's
know
not what you're supposed to do.
that there are many people walking around you who might be infected, and so your exposure risk is high.
Keep that in mind, especially as everybody's traveling home, keep, around each other all the time.
And viruses love cold, dry air. They love when people move inside and are close together. That's the holiday period. And that's one of the reasons why we're not just seeing the flu rise, but we're also seeing RSV, which unfortunately is leading to a lot of infants coming into the hospital and older patients. And then there's norovirus, which causes nausea and vomiting. That also, I've seen a lot of patients with that. It's extremely infectious. So usually when I see one member of a household, I then see other members from that same household come in a day or two later.
I'm going to go wash my hands right after we finish this conversation. Dr. Darien Sutton, thank you so much, as always, for all of your insight.